Hi everyone, this is my project for Foundation of Public Health. My topic is seatbelt legislation and enforcement is one of the successful public health interventions in Nebraska. This project includes three parts. Part 1. Identify and describe how public health is positively impacted. What is public health? According to Winslow, public health is the science and the art of the preventing disease, prolonging life, and promoting health through organized community effort. According to IOM, public health is fulfilling society interest in assuring conditions in which people can be healthy. Public health in motor vehicle crash is an organized community effort aimed at the prevention of death and injury in crash. Public health has three core functions: assessment, policy development, and assurance. Core function 1. Assessment of the motor vehicle crash. Distribution of the motor vehicle crash. According to NISA, 44,599 people lost their life due to motor vehicle crash. About 70.88 fatalities per 100,000 population and 2.1 per 100 million vehicle mile traveled in USA in 1990. According to Nebraska Office of Highway Safety, 257 people lost their life due to motor vehicle crash, about 16.28 fatality per 100,000 population and 1.88 per 100 million vehicle miles traveled in Nebraska in 1990. Therefore, motor vehicle crash is also a major public health issue in Nebraska. Risk factors attributed to motor vehicle crash. From an ecological models, the health outcome, death, and injury of motor vehicle crash are impacted by many risk factors, such as biological factors, behavioral factors, environmental factors, and psychosocial factors. Health disparities in motor vehicle crash. We can see from this figure, the death rate is difference between male and female groups. The death rate is also difference between race groups. Belt use and motor vehicle crash outcomes. According to Rutledge, there were only 3.2% crash injury patient deaths when they wear seatbelt, while 7% crash injury patient deaths when they did not wear seatbelts. The average hospital charge per patient with seatbelt use was $10,500 when compared with $15,250 for patients without seatbelt use. Therefore, seatbelt use can save lives and reduce medical costs for motor vehicle crash. Seatbelt use in Nebraska. We can see from the left figure. Before seatbelt law enacted in 1993, the seatbelt use rate is very low. From the right map, we can see the seatbelt use rate is different in different counties in Nebraska. core function 2 and 3, policy development and assurance. Policy development. These research findings were translated into law and intervention by legislative and public health agencies. From the below map, we can see Nebraska belongs to one of the states with secondary belt law. Ethical principle in policy development. Public policy should take into account other concerns such as harms and benefits of the potential policy. In economics, this is a cost-benefit analysis, but in ethics, harms must also be included among the costs. In addition, public policy should also take into account the basic ethical concepts such as human rights. The success of seatbelt policy contributed to a wide range of participants such as legislative, enforcement, judicial, public health, medical, and public organizations. Leadership and collaboration with key stakeholders are important to success of the seatbelt policy. We can see from this figure. After seatbelt law enacted in 1993, the seatbelt use rate began to increase and reach to about 80% in recent years. From this figure, we can see the red line indicates seatbelt use rate. The blue line indicates death rate. We can see before the seatbelt enacted in 1993, the seatbelt use rate is lower and the death rate is high. For example, in 1990, the seatbelt use rate is 33% and the death rate is 1.88. After seatbelt law enacted, the seatbelt use rate began to increase and the death rate began to decrease. For example, in 2011, the seatbelt use rate is 84% and the death rate is 0.95. So seatbelt law can reduce death rate. The reduction of the rate deaths attributable to motor vehicle crash in Nebraska represent the success public health intervention. Part 2. Identify and describe how your project applies to at least half of the competencies and how they related to your public health topic. The following core competencies involved in this project. 6a. Describe the ecological model of public health. I can describe the public health issue of motor vehicle crash with ecological models. For example, individual, community, environment, public policy all impact on the outcome of the motor vehicle crash. 6c. Communication accurate public health information with professional and lay audience. I can effectively communicate with professionals through the static data, scientific tables and flags. I can also effectively communicate with low audience through easy understand language, such as pictures. 8a. Identify linkage with key stakeholders. In this project, I can identify linkage with key stakeholders in the motor vehicle crash, such as governmental agencies, police, drivers, passengers, and health workers. 8b. Identify different levels of community engagement and participation. From this map, we can see the seatbelt law is different among 50 states. There are 32 primary law states, 70 secondary law states. Only New Hampshire state do not have seatbelt law. We also see from the map the different seatbelt use rate in different counties in Nebraska. 8c. Engage in collaborative problem solving and decision making. The success of seatbelt policy contributed to a wide range of participants. Collaboration with these participants are important to success of seatbelt policy development and enforcement. 9a. Discuss determinant of health disparities. From this project, we can see the race and seatbelt use are determinant of health disparities in motor vehicle crash. 10b. Accumulate how ethical principles apply to public health practice. I have the ability to identify and apply a ethical issue in this project. Ethical decision making, such as harms and benefit of the potential action. Understanding basic ethical concepts such as human rights. So at least half of the competencies have been involved in this project. Part 3. Public health careers according to public health core functions. Public health careers for assessment functions. Epidemiologist for motor vehicle crash surveillance design. Police for data collection. Data analysis by statistician. Core function 2. Public health careers for policy development function. Police maker, for example, state legislative committees. Public health careers for assurance functions. Health educator for seatbelt law. Police for seatbelt law enforcement. EMS health works for healthcare after motor vehicle crash. This is reference for this project. Thanks to Dr. Michael and all my classmates for help in this class. After this class, I have a theoretical and practical basis for public health.